Health and medical folks, here is a video for There we go. That's just a little inspiration for all of you. Oh, and for some reason, I can't see everybody's faces. I'm sorry. There we go. Please hold. All right. Introductions. I'm very quickly going to name everybody that's here on the slide, and then they are going to introduce themselves after. So starting with me, I'm Nick Greenlee. I'm the Director of Student Recruitment for the areas of study. We've got Tracy Cook here from the dental faculty. We've got Kate Saylor from EMT. We've got Julie Liderson from the electronics department, Toya Moore from medical assisting. I hope it's Delphia from the nursing department, Leanne, workforce instruction, and then Jennifer here from respiratory care. And we're so excited to have them, and they're here to speak to you. So here in just a second, I'm going to hand it over to them. But first, again, go ahead and throw your questions in the chat, or you can wait till the end for Q&A, okay? These are the programs that we're highlighting for health and medical. And here is the list of programs that we have in total. So again, if you were here for surgical technology, we've got that. We're just not going to talk about it specifically tonight. But we can help you figure that out later. You can ask a question about it, and we can send you information. And of course, we'll be following up with more information soon. So without further ado, Tracy, I'm going to hand it over to you.
Hi, everybody, and welcome. I am Tracy Cook. I'm the lead faculty of the Dental Assisting Program. The Dental Assisting Program is a one-year certificate program, and for entrance, you just need to pass English 98. Right now, it's a great time to be a dental assistant. Dental assisting and dentistry in general is in extremely high demand. Our class size, as you can see, is average about 20 to 24. Again, you just need to be eligible for Math 98. We're located on Beacon Hill in our Health Education Center, and we have a hybrid structure. So we're doing in-person and online. We have clinical and didactic. You can take 6 additional courses and receive an AAST, which is an associate's degree in technology. And once that's completed, you're also eligible to apply to our bachelor degree program. The dental assisting program is 4 quarters. It's 1 quarter of didactic, mostly infection control. Second quarter is when we introduce radiology and clinical. And our third quarter is a 2-day per week internship, in addition to your didactic, which are your bookwork courses, and clinical. And in the fourth quarter, we have about 75% paid externships. So that's a really, really great opportunity. And the reason why we are allowed to provide that is because we have so many dental clinics and offices that really, really need a dental assistant. So much so that they're willing to pay a student during their fourth quarter of their education.
Great. Thank you, Tracy. Is there anything else that you wanted to share here? I know we've got some highlights here, just in terms of the skills that they're going to gain in the program.
Sure. During the first quarter, we're introducing dental terminology. We are heavy on infection control. That is very, very important. We also introduced some teeth polishing in first quarter. We have in second quarter, when we introduce radiology, we also have an opportunity for each student to go to the University of Washington Pediatric Clinic. And so they're actually working on some kids there, learning how to bring the patients back, do some polishing. And we are in the process of doing a makeover of our student practice lab, and we're going to be getting new equipment, new chairs, new lights. It's already a beautiful facility, but by next fall, it's going to be even better. So we're really looking forward to the makeover of our clinic.
Excellent. Thank you so much.
Mm-hmm.
Kate, I'm going to hand it over to you. And Tracy, I just want to thank you. I forgot to mention before, Tracy kept it really concise. We are looking at about 4 to 5 minutes per presenter, just because we have so many programs to get through. But without further ado, Kate, I will hand it over to you for EMT.
Thanks, Nick.
Yeah.
So hi, my name's Kate. I am an emergency medical technician right now, currently working for TriMed Ambulance. I'm also an instructor. I've been teaching for about 1.5 years. I think it's the next slide, please. Thanks. So the program is only 1 quarter long. It's quite short. We're located at North Seattle, and we have basically 2 cohorts that run. So you can do a Monday to Friday, or a Monday and Friday class, or a Tuesday and Saturday class, kind of depending on what your schedule works for you. And then both classes come together on Thursday nights for a lecture. The 2 other days are a skills in-person class. Class size is about 36, and we break you off into smaller companies. So you're working in groups of about 8, depending on how many rotations you do, anywhere from 6 to 8. So you get small groups, and you're getting one-on-one instruction with instructors. All of our instructors are currently in the field or retired, and we have a massive background. So whether they're coming from the fire department, private ambulance, law enforcement, ER tech, kind of anything in the background. And then we have people who are also currently working in those jobs who are using them as stepping stones to go on to nursing or PA or med school. It's really cool because you get such a diverse background. You can come any quarter. I will say if you come summer quarter, we only have 1 cohort, and I think it's a Monday and Friday class. It's a great stepping stone. So I went through this class actually in the fall of 2021. And then by December of 2021, when I finished, I already had a couple job offers. And so I've now been in the field for 2 years. In this class, we're getting you set up to take the NREMT, which is the national registry. And then from that, with that certificate, you can basically go and get a job. Yep, there, thank you. You can go and get a job at basically any private ambulance company. And if you're working to go towards fire or towards paramedic or something else, that is something we can also help you go for. Thank you. To come into this class, there is an entrance exam, and then we have a couple mandatory requirements. So we have that entrance exam, and then you just have to be 18 years or older. You need a high school diploma or GED. We will help you get a CPR card. So there's a CPR class right before the EMT class that starts that we give you the opportunity to get your AHA card if you don't already have it. You need a driver's license. We'll do a background check, and then you need proof of vaccination. And then as you kind of can see, sorry, flipping around. We teach you guys a lot of skills. So just the ability to perform the duties that come along with being an EMT. So being able to get down on your hands and knees, working with your hands, and doing skills. Thank you. So I guess there are some of the skills we'll teach you. So patient assessment, splinting, bleeding control, spine immobilization with backboarding and KED, and some other really cool things that we do use in the field. It's a really great opportunity. It's an amazing stepping stone. I will throw either my contact or Megan's contact into the information in the chat, or if you come to the breakout room at the end, I'll give you some more. So if you've got questions, you can come and chat. Last thing before I go on, sorry. This is a 1 quarter long course, like I said. I think it's about $1,600 plus a couple of fees. But we do have a lot of scholarship opportunities. So I was actually a Medic 1 scholarship recipient. I'll throw in a link into the chat as well for how to apply to that. And then certain companies, so my company, TriMed Ambulance, if you get in contact with them, they're also offering scholarships where they'll pay for your full course. And then for TriMed, you exchange, I think it's 18 months of employment afterwards, but you're guaranteed a job as soon as you finish. And it's a really great opportunity. So thank you.
Great, thank you, Kate. Really appreciate it. Now we'll move on to Julie, Healthcare Technology Management.
Thanks. Yeah, I'm Julie Liderson. I work in the electronics department at North, and I'm going to tell you about one of our degrees. It actually is a really long title. You see part of it on screen. The full title is Healthcare Technology Management / Biomedical Equipment Technology. It's an applied Associate of Science degree. Applied meaning we're getting you hands-on, so you're working in labs, getting that really practical experience from beginning with your first class. The purpose of this degree really is to design or prepare students so that they're ready to maintain and repair that wide range of medical equipment that requires knowledge of and specific skills in electronics. This is a great program for students who are really hands-on oriented and kind of people that like to take things apart and figure out how they work. Full-time, a student can complete in 7 quarters. It is primarily in person. There are all of your electronics classes will require that you be in person. There will be some classes within the context of this degree that you can take online. So your project management course can be taken online. Your medical terminology, some quarters is offered fully online. You can begin any quarter. Fall, winter are probably the preferred starts, but we can come up with a great plan regardless of which quarter you begin. Our average class size, 16 to 24. We have some classes, or one class that we cap at 16 students. Largest class we've had in electronics is maybe about 30 students, but usually 16 to 24. We need to see that you place into English 98. Ultimately, for your associate degree, you'll need to take English 101. Math 84, which is Algebra 1. If you placed into Algebra 1, you're ready to roll with electronics, and you'll be taking a math class that's contextualized for electronics. And if you're an English language learner, we want to make sure that you've placed at level 5A, and North's ESL department can help you to determine what your placement level is there. Classes are on campus at North. And next slide. Go ahead. So some highlights. So in the workplace, students that are completing this degree, they're really focused on all of that kind of patient monitoring, all healthcare related equipment that's critical for high quality patient care. So our students are going to work generally as biomedical equipment technicians. They're known as BMET, B-M-E-T. And our classes are going to be a combination of, you're going to get your theory through lecture, you're going to take a break, and you're going to go across the hall or downstairs and move into one of our labs and apply what you're learning. So we've got 5 electronics labs at North. They're all housed in the same building. So again, this is an applied program, so really focused on getting you hands-on as much as possible. You're going to be developing a really strong foundation in core electronics courses. And these are going to apply to all electronics related fields. So outside of the healthcare sector, or certainly within healthcare, you'll be completing some courses that are to give you some real specialized training specific to the healthcare industry. So students in this degree program, they're taking chemistry, they're taking medical terminology, and the rest of your electronics courses, as I mentioned, they're going to be relevant across sectors of the workplace. Our instructors come to us from industry, so they've got that really relevant experience. They're an excellent resource for students, and given where we're located in this region of the country, in the greater Seattle area, we're a really excellent location for biomedical research and manufacturing employers and healthcare. And let's go on to the next slide. Thanks. So in your final quarter of your program, you'll be completing an externship, and generally students are doing that. And I see we had a slide change there. Okay, and students who are completing those externships are generally in hospitals or in a clinical engineering setting. They might be working with a medical equipment manufacturer. This is a really fantastic opportunity for students to get practical experience, but it's also a really great opportunity for employment. A lot of students move from those externships into full-time employment. We've got graduates and externship students in all of the greater Seattle area, hospitals and medical facilities. And typically they're moving into, they graduate and they usually start as a BMET 1. And they progress through those levels. It's not a rule, but typically you're going to see BMET levels 1 through 3, and then have opportunity to move into lead and management positions. And I think that's kind of a good, I hope this gives you kind of a good sense of what it's all about. And I'm glad to meet with anyone virtually, in person, to give you a tour of our labs and talk more about this program pathway.
Great, thank you so much, and apologies for those technical difficulties, trying to make sure everybody can see everything. So thanks for that information. We're going to move to our next slide here. Toya, turn it over to you.
Hey, I'm Toya Moore. I'm the director of Seattle Central College's Medical Assistant Program. We could go on ahead to the slide to go over the program. I'm gonna keep it at the 4. So we can go to the next slide. All right, it's a certificate program. The cap is 24, 3/4 long, 57 credits. It's a true cohort program, which means you cannot take it part-time. You cannot take it in any other way but the scope and sequence that it is in. That means Q1, Q2, Q3, you'll be taking courses CMA 101 through CMA 109. The modality of instruction is in person or online. We really accommodate our students. So if you're a student that has been doing great, you've been coming in, having your attendance, and something comes up, we will make the program online for you. Our objective is to get you through the program and get you certified as a medical assistant and working in the field. We have 4 starts a quarter. So we have fall, winter, spring, summer starts. The only requirement for our program is that you have a GED. And again, we're only located at the Seattle Central College, but we're at the Health Education Center. You go to the next slide, please. All right, the highlights of the program: not only do we prepare you for the certified medical assistant exam that's required for Washington State, it's also included in the program. So you are not responsible for paying the $150 fee out of pocket, and we prepare you for your national certification exam because you will not be able to work unless you pass it. We have a 98% pass rate, and usually, depending on the situation of the student, usually if there is a language barrier, we also let you retake the test. Usually students are only 4 points away, and that's a little devastating, and we like to support them. So truly, our national exam pass rate is 100% once they take it again. Again, you're eligible for your Washington State certified. You need to have that as well to work as a medical assistant in the state of Washington. Our externships are every hospital and clinic in the surrounding areas of Seattle. We also work with students that live outside of the surrounding areas. If you can find you a clinical site that's close to your home, we work with them and have an affiliation agreement so your commitment can be completed and you can actually work there. So we have 98% job placement as well. Do I have another slide? All right. Medical assisting is simply that. Anywhere you can think of a medical assistant where people need medical care, that's where you can work. I actually was even a medical assistant at Progressive Insurance because there are people there. So wherever there's people and there's a need for medical care, believe me, you can work there. You can work for the Seahawks as a medical assistant. So there's really no limit in the arena that you could work as far as a medical assistant, which is the reason why I'm saying it's a growing industry. But given there are the typical emergency departments, primary care clinics, nursing homes, and again, not only is it a 98% satisfaction rate, but job placement and national exam pass rate as well as retention. This is because our faculty is in the field. The program is created for student success, including the financial aid that's available for students. We have several packages. Our goal, again, is to prepare you. You learn how to become a medical assistant through this course, and we get you ready to do medical assistant, graduating as a certified medical assistant with your MAC, and you're ready to rock and roll. So that's what we do. We get you ready to get out there in the field. Thank you.
Great, thank you, Toya. Delphia, over to you for nursing.
Yeah, I'm Delphia Wright Thompson, and I actually am a graduate of this nursing program all those years ago. You can go to the next slide. So our program offers an associate degree in nursing. It does take about 2 years, which is 9 quarters. We only do in-person. We don't do hybrid at all. And we do admit in the fall and the winter. So we admit 90 students in the fall and 90 students in the winter. We are spread out over the 3 colleges. So even though our students are considered Seattle Central College students, we do have classes at South Campus and at the North Campus. And once you apply and enroll, we ask you which campus you would prefer to be on. And so we try to honor that so that you are closer maybe to your home or to your other jobs, because most of our students still work. You have to have a nursing assistant license to a certification to be eligible to come to the nursing program. But we do offer that on the South Campus. So we have a nursing assistant program on the South Campus. It takes about 1 quarter to become a nursing assistant, and then you pass the certification exam. And you can see how many credits that you have to have, which is about 45 credits of prerequisites. There are a lot of prerequisites, a lot of different courses you have to take to become a nurse, but they're all listed on the website if you want to look at that. And you can see you have to have a 2.5 GPA and then take the TSET test. We, in terms of admission, we offer a lottery. So everyone who meets those requirements, we put all their names into a big pot and kind of pull out 90 names. So everybody has an equal chance of being accepted into the program. Next slide. So this program will help you or prepare you to succeed on the NCLEX RN licensing exam. So actually, we're doing 2 things. We're preparing you for the exam, but we're also preparing you to be a nurse out there in the field. So we have nursing theory classes, we have clinical classes, and we also have skills labs. We have simulation labs that we run the students through these simulations so that they can practice being a nurse without actually harming anyone, so that they can make all their mistakes in a simulation lab. And when they go out to practice with their instructor, their clinical instructor, they're less likely to make mistakes. And students find that to be very helpful to them as they go through the program. Just like medical assisting, I think nurses are everywhere. So you can be working with the sports team, you can work in ICU, and a lot of our instructors come from various backgrounds. So we have instructors who have been flight nurses, ER nurses, ICU nurses, labor and delivery nurses. I myself was a med-surg nurse, and I also worked in public health for a number of years, working with children. So a pediatric nurse. We have students who, instructors who work in psychiatric mental health. So the background of our instructors are very varied. And most of us, all of us who teach in the theory have to have a master's in nursing anyway. And we do have instructors who actually have doctorates as well. Next slide. Is that it? So again, you're going to be eligible to take the NCLEX RN exam, and that's a national exam that you have to take to become a registered nurse. But it also, most of our students go on to get their Bachelor of Science in Nursing, and they also then go on to get their doctorate in nursing. A lot of our students are wanting to be nurse practitioners, so we're having a lot of them go through that pathway. Again, nurses are everywhere, so a lot of our students are at the hospitals around the region, but again, they're in clinics as well. They are in school. We have nurses who do school nursing as well. So nursing is really varied. And again, I think during the COVID, nurses were very much highlighted about what we do. And I always just advise students that it's not what you see on TV. Okay. The doctors are not at the bedside. It's the nurses. It's the nurses who are at the bedside who are helping patients day by day. And we are the doctors and the providers' eyes, so that they know what's going on with these patients. But by and large, if you are the kind of person who likes adventure, because you will have that with patients, if you like to take care of people, then this is going to be the field where you will have a really good time and make sure that you are helping people throughout their lifespan. Is there another slide? I think that was it.
No, I think that's it. Thank you, Delphia. It sounds exciting
Yeah.
and good and noble work. So thank
Yeah.
you. Moving over to pharmacy technician with Leanne.
Hi, everyone. My name is Leanne. I am the Pharmacy Technician Program Coordinator and one of the full-time faculty as well. We just jump into the next slide. Thank you. So the Pharmacy Technician Program at North Seattle College is 9 months long, so 3 quarters. And we are also a cohort model. So students will start in the fall, they'll end in spring. You have to start in the fall. You can't start midway. And you would go with your entire cohort of students from fall, winter, and spring. We have some entrance prerequisites, placement into English 101 and Math 98, but we are an IBEST program, which allows students who don't test into those levels to still enter the program with extra support. So there is a lot of options, and we want to make access easy for students who are interested in this pathway. We are also a hybrid program, like some of the programs that have just presented. So we are actually on campus on Mondays only. And we're on campus Mondays all day, though. I'm talking like 8 a.m. to 5 p.m. all day long in class. We just chock it full with all the stuff you're going to do on campus. And then on Tuesdays, we're on Zoom all day again. So it's a long virtual day. But Wednesday through Friday, you work on stuff on Canvas online at home, watching lecture videos and doing assignments and quizzes. So that happens at home. So we are a true hybrid program. And we are currently only located at North Seattle College as well. Can I get the next slide, please? So things that you would do in the program, well, we're a pharmacy program, so we're all about the drugs. We teach the top 200 to 300 drugs that are out there. And this, excuse me, involves all the names of the drugs, and there's at least 2 different names for every drug. And then we go into pharmacology, mechanism of action, how they work in your body, treatment options for patients, and then there is a lot of patient communication and skills like that are involved in pharmacy as well. So we do a lot of patient care, but pharmacy-focused patient care. And like I said earlier, we're a hybrid model, so we're really a great fit for those who work or have other obligations outside of school, since we have this hybrid learning model that allows you to remotely learn 3 to 4 days a week. We prepare you to take the national exam. The national exam is taken after the program is done, and we have a 97% first-time national exam pass rate. So we're very proud of that and excited for all of our graduates who go on, pass the exam, and apply for the technician licensure upon graduation. And if I could go on to the next slide, please. We also have an externship piece that starts in the winter and spring quarters, so quarter number 2 and 3 of the program. You will get placed at a pharmacy in the area, and you'll complete hours in winter and spring, and those hours total to 432 hours of externship at a pharmacy. And there's a lot of practice types out there. You know, you might think of the Walgreens and Rite Aid and Bartell's that you see down the street, but actually every hospital has a variety of roles for pharmacy technicians, including being in the emergency rooms, being a medication reconciliation tech, making the IVs for all of the patients that are in the hospital, also making up the medications for those who are leaving the hospital, insurance companies, compounding where you actually get to like follow a recipe and kind of cook up the medication, which can be fun too. There's really a lot of different practice types out there. And you go into those practice types for externship, and those are the same kind of practice types that you could jump into upon graduation and start your career in. A lot of our students get jobs through their externship, which is really cool. You are looking at a very high demand career. If you look in nd.com right now, I think just this morning there were 85 jobs in the Seattle area. And for a 9-month certificate, we're talking about an average wage of $28 to $38 an hour. So it's a fairly well compensated for the amount of time that you're in school type of career field. And there's so many practice types out there. There's something for everyone. And a lot of my students use this career path as a stepping stone. You could start off in farm tech. It's a low barrier, easy, get into this program and start your healthcare career, and then step up to something else that you're interested in, be it PA or going all the way to pharmacist. I'm actually a pharmacist, went to UW School of Pharmacy. So there's a lot of options there, but then there's also probably the equal amount of students who get into the career field and just love it in there. And they excel. And they go on to supervisory roles, they go on to other specialization roles, and some of them are making upwards of $50 an hour. So it's really an exciting place to be, and it's a great place to be right now because the demand is so high, and the career options and professional kind of scope of practice is advancing so much right now that you can find something for yourself. So thank you for this time. Let me know if you have any questions.
Great, thank you. Your enthusiasm is making me think about becoming a pharmacist, so thanks for that. Over to Jennifer for respiratory care.
Hey everybody, this is Jen Clark. I am the program director and full-time faculty for the respiratory care bachelor degree program. And we'll take the next slide there. I'm not only the program director and faculty, I'm actually a graduate of the program. I practice as a respiratory therapist at Harborview. And our degree is a little different than some of the other degrees you've seen here because you do receive a bachelor's degree, which means in the community college system, great return on investment, but it also means that there's a few more prerequisites for our program than there might be for other programs. The way we get all 4 years in is that you spend 2 years doing some STEM focused prerequisites in the sciences, and then you apply for our program to join a cohort where you will stay with the same students and work alongside your cohort classmates for 2 years. And at the end of that, you'll graduate with a bachelor degree. The portion that the money that you're gonna spend while you're in our portion of the degree is gonna be about $20,000, and you're gonna graduate making about $85,000 out of the gate with lots of opportunity for advancement. Our program is in person. We do didactic classes in the classroom. We do lab, hands-on, lots and lots of hands-on. And then you also will spend time in the hospital at the bedside working directly with patients in the Seattle area. So it is all in person, but that's because our technology really demands your ability to be able to work with the equipment. And we feel that being in the classroom really enhances that creativity and that curiosity for the equipment that is involved in our degree. And I'll talk to you a little bit more about the field in just a second. Our program does start in the summer. The reason that is because we have a tiny little baby quarter that happens in the summer, and then you spend 7 full-time Monday through Friday. And I say Monday through Friday because we're going to have classes at the beginning of the week, lab sometime during the beginning of the week, and then you're going to be in the hospital Thursday or Friday working alongside patients. So it is kind of a Monday through Friday daytime program, but we do try to get our classes to have them start just after people are dropping kids off at school and have them end before you got to pick those kiddos up. So we do try to do it within working hours, and we try to accommodate where we can, but right now the field really demands that it be an in-person program. We are located at the Health Education Center. That's that beautiful building you see behind me. It's a really exciting place to come and learn, and you've heard from multiple programs that are housed in that building. It's all the stuff that we got going on inside. It's the latest technology. It's super new. We got all kinds of toilet paper and beautiful bathrooms. So there's lots of bonuses of coming out to the Health Education Center. Let's look at the next slide there. So you may not be super familiar with what a respiratory therapist does, but I bet you've heard the name by now. The COVID pandemic certainly put us on the front page of the news. We are the folks in the hospital that are doing full contact medicine. We're in the emergency room, we're in the intensive care unit, we're on the floors. There are some people that are out there working out in doctors' clinics and at pulmonary function labs. But we really do a deep dive into cardiopulmonary health. So when you come to a program that focuses on cardiopulmonary health and ends in a degree as a respiratory therapist, you're basically learning life support, that in terms of how the heart and the lungs work together. So we teach you to work mechanical ventilators or breathing machines. We teach you all kinds of other toys and technology that help somebody, that ease somebody's breathing or supports their life while they are healing. And at the end of it all, you are a licensed practitioner. So you're going to take some credential exams and you're going to pass them, no problem. Our graduates have never had any problem passing our credential exams. In fact, we've got a really, really good reputation out there for that. And then you're gonna pass those exams, you're gonna get a license, and you're gonna move on into your career, and you're gonna start somewhere in the $40 an hour range, but you're gonna quickly move up a little closer to the $50 an hour range and work 12-hour shifts, maybe 3 times a week. And that's a full-time gig. You can have that side hustle, no problem, or pick up some overtime and pay back those student loans really, really fast. So it's super in demand. There's plenty of opportunities out there. All the major hospitals right now are hiring. Most of our students have either a paid internship opportunity while they're in the program, and if not that, at least a job offer before they exit the program. So right now it's a good time to join healthcare because everybody's looking for some new fresh faces that are excited about the career. Can we get that next slide there? Okay, so our program's been around since 1969. We're pretty well established at Seattle Central College. And the folks that are working within our program either work within the hospital as a respiratory therapist, or they work in the classroom and in the hospital as a respiratory therapist. And we've got graduates all throughout the region, and quite a few graduates that have moved on from the state of Washington. But you really can't throw a stone at any hospital without running into a Seattle Central graduate as a respiratory therapist. In fact, we consider you family once you're in our program, and your family once you get out there in the hospital and you continue your career. And you'll find respiratory therapists at all those hospitals that you see there on the slide and more. Hundreds of us out there. When you join our program, you're going to have a chance to get to see how each hospital works, because you're going to rotate around and spend some time with patients in each different hospital. And so you're going to kind of get a really good feel for what kind of environment you like. The emergency room, the intensive care, the acute care floors. You're going to learn whether or not you prefer to work with tiny little babies, you prefer to work with patients that are going to talk and interact back with you, or work in the intensive care and work in that life support mode. But we're going to prepare you for it all. In fact, we're going to prepare you to the highest level so that when you get out there, you can jump in and do whatever your hospital demands of you. We are what I like to call kind of the gophers of the hospital, because we pop up everywhere. We kind of know what's going on in the hospital, and we're going to be there whenever somebody has some breathing difficulties. In the chat, I have put a flyer that outlines our prerequisites. I've also put a little movie that tells you a little bit about what a respiratory therapist does. And then if this at all has gotten you interested, please shoot me an email or get in touch with our advisor or click on our website, because while we have already had our application process for this year starting this summer, I certainly am happy to talk to you about wherever you are now and whether or not you need another year, another 2 years, or maybe you've finished the prerequisites and we can talk about getting started this year. So get in touch if you have any questions.
Great, thank you so much, Jen, appreciate it. Really quick, all those, let me turn on my video here, hopefully you can see me. Thank you to everyone who just presented. We really appreciate it, from Health and Medical. Those of you who are here attending the event, I would highly encourage you to get in touch with them. And the best way to get in touch with them is first to go to our Discover Feedback page and let us know who you are, what your email address is. Give us a little feedback on the event so that we can make it better for future students. but we want to hear from you, and then we want to connect you with the right person. I'm going to be following up with all of you here for health and medical, just to let you know that I'm available to talk. And if I don't know the answer to a question that you have, I'm going to connect you with Leanne. I'm going to connect you to Toya. I'm going to connect you to whoever you need, right? So be on the lookout for that from me. Health and medical people, feel free, please actually stay on. We'd love to have you stick around. I'm going to pivot now to education and human services. So please hold